to the ISID Speaker Series. My name is Eliane Ubalijoro. I'm the Global Hub Director of Future Earth in Canada, as well as the Executive Director of Sustainability in the Digital Age, and I'm a Professor of Practice here at ISID. So I would like to welcome Rachel Kiddell-Monroe. She's the Executive Director of SeeChange Initiative. She's also a board member of Médecins Sans Frontières and my colleague as an ISID Professor of Practice. So Rachel is a lawyer and an activist focusing on humanitarian assistance, access to medicines, global health governance, and global health ethics. So she's worked for a number of grassroots and indigenous organizations, and she's worked in the Republic of Congo, in Rwanda, my homeland, and after acting as program director for MSF Canada, she became MSF's regional humanitarian affairs advisor for Latin America, based in Central America. And so now she's on the board, and on top of everything she does, she's also a former president of Universities Allied for Essential Medicines. So welcome, Rachel. It's really wonderful to have this conversation with you. And also she lectures on international development and humanitarian action. So you are working on an approach called community-first solutions to health crisis. Can you tell us what that means?
So the community-first approach is really about putting the community at the center of the response. From all my years of working with Médecins Sans Frontières, working in different countries around the world, I often try to make sure that I consulted with the communities, that the communities were really able to understand the response that was happening. But often it's difficult. We come from the outside with an approach in order to deal with the emergency, and it's often difficult to bring the people on board. As I was leaving MSF, I really got the stronger and stronger feeling that we need to start from the other way. Start from where we talk to the community and say, how would you see the best way to respond to this health crisis that's affecting your community? And what we found is that people have the answer. People have the answer inside the community. They know what they have, they know what the assets and resources they have, and they know what support they need. And so with COVID-19, with the tuberculosis crisis here in the north of Canada, we've been really trying out this approach of actually asking people what they want first, and then creating solutions that are adapted and can be adapted to their environments. So community first really means a radical community-led approach where the community is the owner of the response, the director of the response, and the implementer of the response. And as people who want to help, as humanitarian aid workers, we come in and complement and supplement and give technical support and resource support as and when needed.
So how do you think this community-first vision will impact the way emergency response is carried out?
I'm hoping it's going to have a very fundamental impact. I think that there is already a lot of move toward this sort of community-led, we're talking about people-centered approaches, community-led responses, but what we haven't seen so much is really a bringing together of community driven responses themselves, because communities are responding all over the world. In COVID-19, communities have been left to the side, and we're talking really here about the most marginalized, most vulnerabilized communities. And they've often been left to their own on the COVID-19, and they are the front line of the pandemic response. And they've been coming up with solutions themselves. And so what we've been doing is working with communities and helping them. So to give a concrete example, in Honduras, we work with an indigenous community. We have a sort of emergency planning, which they adapted to their community. And they said, well, this is great, but we can't socially distance very much because we have very poor housing, we don't have many resources, so we live, a lot of us, together, and we're very communally based. And so we need these masks and these disinfectants and hand soap, we get that, but we don't have them, and we don't have the money to buy them. So then what we did at SeeChange Initiative was we helped to procure material, we got disinfectants, we got materials to make soap, locally in Honduras, and then the community got that. They made their own soap, and now they have sewing machines and they're making masks, and the community is being provided like that. And this was how we worked with them, as well as doing training and webinars, and most importantly of all, accompaniment. Because I think there's one thing that's come out of COVID-19 is how much that solidarity, that one human putting out his or her hand to another human being and saying, I care, I'm here, I hear what you're going through, let's get through this together, that has been really, really powerful. So my idea is that showing and demonstrating this approach in practice, providing the evidence base, can help to shift and influence public policy and humanitarian organizations.
Thank you very much, Rachel. This was really inspirational and really concrete in terms of how do we empower local communities. So thank you very much. And for all of you listening, welcome. Really, thank you for listening in to the ISID Speaker Series for this talk, and look out for other talks coming soon. Thank you.
Thanks, Eliane.